Welcome to the Tobacco Online Policy Seminar TOPS. Thank you for joining us today. I'm Pingchuan Ma, a researcher in Dr. Shang's lab at The Ohio State University Center for Tobacco Research. TOPS is organized by Michael Pascoe at University of Missouri, Si Shang at The Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hartman-Boyce at the University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussant. The audience may post questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they're not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available, along with the presentation slides, on the TOPS website at tobaccopolicy.org. I will turn the presentation over to today's moderator, Si Shang from The Ohio State University, to introduce our speaker.
Thank you, Pingchuan. Today, we continue our summer 2026 season with a single paper presentation by Brad Davis entitled Restricting Sales of Flavored Nicotine Vaping Products, Effects on Nicotine Vaping Product and Cigarette Sales in Canada. This presentation was selected with a competitive review process by submission through the TOPS website. Dr. Brad Davis is a postdoctoral fellow in health economist at the University of Missouri's Social Impact Lab. His research examines the effects of public policy on health behaviors and outcomes, with recent work focusing on tobacco regulation and cancer screening. He uses quasi-experimental methods and large administrative and retail data sets to evaluate how policy changes affect consumer behavior, healthcare utilization, and health outcomes. He serves as an administrator for the Tobacco Online Policy Seminar TOPS and earned his PhD in economics from Florida State University in May 2024. Dr. Mike Pascoe, a professor at the University of Missouri, is a co-author of the study and will answer select questions in the Q&A. Dr. Davis, thank you for presenting for us today.
All right. First off, thank you to everyone for being here, and thank you to the TOPS Executive Board for having me back to present. So today I'll be presenting my work on restricting sales of flavored nicotine vaping products and the effect that has on vaping product sales and cigarette sales within Canada. This is joint work with Mike Pesco and also Abigail Friedman. So first off, I'll start with the disclosure. This work is supported by National Institutes of Health, the FDA, and also Health Canada. And the views expressed in this presentation are the views of the authors and not necessarily the views of the funders. In addition, I nor my co-authors have received any tobacco or pharmaceutical-related funding in the previous 10 years. Or I should say from tobacco and pharmaceutical companies. And then also we want to thank Health Canada for providing some of the data we use in these analyses, and then also the University of Missouri's Social Impact Lab for programmatic support. So in recent years, we've seen a number of government entities restrict nicotine vaping products. Over 40 countries have outright banned nicotine vaping product sales. 15 countries have flavor restrictions on nicotine vaping products. And then within the United States, 7 states have restrictions on nicotine vaping product flavors, as well as around 200 local governments. Now, the stated rationale for these policies is often to reduce youth appeal to vaping, who might be attracted to it due to the fruity flavors that these vaping products often come in. Now, we think about how consumers might respond to a flavor restriction on vaping products. There's a number of different responses. One, this could reduce initiation into the vaping product market. If for consumers who might be tempted to initiate into it due to the flavors. For consumers that are already in the nicotine vaping product market, they could exit the tobacco market entirely. They could substitute to a flavor that's not prohibited, such as maybe an unflavored vape product or tobacco flavored vape product. Or they could substitute to a tobacco product that is not within the vaping category, so including combustible tobacco. Now, this fourth possibility is a particular key public health concern because while vaping is harmful, cigarettes are far more deadly. So in this paper, it's estimated that vaping has 37% the quality adjusted life years harm of that of smoking, and we know smoking can have an impact on life expectancy, estimated on average to be 4.3 years. So a key policy concern or a key question is, do vaping product flavor restrictions cause substitution to combustible cigarettes? Within the US, we have some compelling evidence of this. We have numerous studies that show that these vaping products or these vaping flavor restrictions lead to increases in cigarette smoking. In addition, Friedman et al. Estimates that for one fewer vaping cartridge that's sold due to a flavor restriction, 12 additional cigarettes are purchased. So we already see evidence of substitution within the U.S. market, and then the big systematic review finds that out of 21 population studies, 15 of these studies report an inverse relationship between vaping product availability and youth cigarette smoking. So again, there's some evidence of the substitutability between vaping products and cigarettes, even among youth. So what do we do in this paper? We leverage provincial variation in NVP flavor restrictions within Canada to estimate the effect on vaping product sales and cigarette sales. This is some of the first causal evidence outside the US on how vaping product flavor restrictions affect the tobacco product market. So why do we care about Canada's regulatory, or about this study in Canada in particular? Well, one thing that's of note is that Canada has a stricter tobacco regulatory environment. And so some examples of what that looks like. Canada has a national menthol cigarette ban. They have more restrictions on flavored cigars, mandatory plain packaging, and a nicotine concentration limit within vaping products of 20 milligrams per milliliter. And so these different policies can affect the substitutability between vaping products and cigarettes. So let's just take the first one, for example, the national menthol cigarette ban. Let's say we have a consumer who prefers the flavored vaping products, and maybe their next preferred product might be a menthol cigarette. In the presence of and so let's say there's a flavor restriction, maybe they would substitute to that menthol cigarette. But within Canada, where the menthol cigarette is banned, there's fewer, that option is no longer available. And so maybe they might decide to substitute to maybe a tobacco flavored vape, or maybe they might exit the tobacco market entirely. So in other words, with fewer combustible alternatives, there might be less substitutability between these two products. But if we find evidence of substitution in Canada, despite its stricter tobacco control environment, it suggests that the substitutability between vaping products and cigarettes may be generalizable across countries, even countries with different tobacco control environments. So this table here gives an overview of the implementation dates of these different policies across provinces. So during the time of this study, there are 6 provinces that adopt a vaping product flavor restriction. Now there is some variation in the scope of these restrictions. So some of these provinces, such as Nova Scotia, they outright ban the sale of flavored vaping products at all locations, while others limit it to specialty vape shops. In addition, there are differences in which flavors are exempt from the policy. So all 6 of these provinces, they allow sales of unflavored and tobacco flavored vaping products. But Ontario and Saskatchewan allow for mint or menthol flavored sales. And then there's 4 provinces that don't adopt a flavor restriction during the time of this study. I should note that Quebec has since adopted a nicotine vaping product flavor restriction, but it was after the time period of this study. I believe they adopted it in 2023. So for our data, all of our data is from July 2018 to June 2023. We get our vaping product sales from Nielsen IQ. Our sales data is specific to the gas and convenience store retail sector. We observe sales in 6,000 stores, which makes up about 24% of the gas and convenience store retail sector. And this data is by UPC and province and 4-week time period. And so UPC is just the barcode that is on the product. And so with the UPC also comes a lot of detailed data on the product characteristics. And we're able to categorize these sales into different flavor categories. Now there's 9 provinces in this sample, but some of the provinces are aggregated to date, or some of the provinces are aggregated within the data. So there's only 6 panels in total. So Alberta and Quebec are our control groups. And then we have British Columbia and Ontario, and then 2 province groups. So the Maritimes are aggregated together, which includes New Brunswick, Nova Scotia, and Prince Edward Island. Now, this is just the way the data came. So there's no way for us to disaggregate across those 3 provinces. I wish we could, but unfortunately we cannot. And then also another province group made up of Manitoba, which did not adopt flavor restriction, and then Saskatchewan, which did. So I'll describe this more in my analysis, but in our model, this group will receive a partial treatment. And then our cigarette sales data comes from Health Canada. And this data is on shipments from manufacturers and importers to retailers and wholesalers at the province by month year level. This is high quality data because it's mandatory that this be reported under the tobacco reporting regulation laws within Canada. So it contains the universe of cigarette sales of legal cigarette sales within Canada. And it's available at the province, it contains all provinces and territories. For our main analysis, we restrict it to the 9 largest provinces based on recommendations from Health Canada, but we also do include a sensitivity check where we use all provinces and territories. And then we also utilize data from Google Trends and this is going to provide a measure, or yeah, this data provides a measure of Google search intensity for two different outcomes. So we look at Google searches containing the phrase vape shop, and then also Google searches that are categorized by Google as being related to NVP or e-cigarette shopping. And so while this is not a measure of sales in other retail categories beyond gas and convenience store, we do think it is it is informative of consumer interest within these other categories, and is therefore useful for our analyses. So I'll start by describing a basic to a fixed effect model, where our outcome is the log of the or the natural log of the vaping product unit sales per capita, or the natural log of cigarette stick sales per capita, where flavor restriction is our variable of interest, which is proportional to or is equal to the proportion of the province or panel with a flavor restriction in month year T. So for most of the data, that's a 0-1 binary. For those panels that are grouped together, it's equal to the proportion of the population with a flavor restriction in place. And then we also include a vector of covariates that are broadly under two categories, one being other tobacco policies, and then also policies related to the COVID-19 pandemic. So for tobacco controls or tobacco covariates, we use cigarette taxes, vaping product taxes with separate variables for ad valorem rates and also excise rates, e-cigarette nicotine concentration limits. And then for COVID covariates, we include COVID-19 deaths per capita, a measure of non-essential business closures and internal movement restrictions, and then also a binary indicator for the Atlantic bubble, which was a COVID-related policy within the Atlantic region of Canada. And then our model also includes province-level fixed effects, which are going to control for the time invariant characteristics of each province, and then month-year fixed effects, which control for national trends or national changes in tobacco sales within Canada. Now, there are recent advances in the difference in difference literature, which highlight that when you have an environment with a staggered adoption policy, it can bias the estimates due to comparisons between newly treated provinces and provinces that have already been treated. Now, there's a number of different strategies to try to mitigate this concern. The one that we go with is called the stacked difference in difference model. Essentially, what this does is it reconstructs the data into event time rather than calendar time. So for every province that gets treated, we take 21 months of data before and after that policy gets adopted for that province, and as well as the controls, and that creates one stack of data. And then we do that for every province that adopts, and then you stack that data on top of each other, and it's now in event time. So that's kind of a brief 1-minute overview. Now, 21 months was chosen just because that's the longest that could be chosen based on the data that we had. And then in the stack difference in difference model, you also include the stack by unit fixed effects and stack by event time fixed effects. Now, there has been a recent update to the model from the Wing, Friedman, and Hollingsworth paper, essentially showing, or this paper introduces some weights that help properly balance the model, and so that we include those weights in our analyses. Now we do a number of robustness and sensitivity checks. For our sensitivity checks, we do a model where we use volume as the sales outcome. In our main specification, we use units because volume is missing in about 1% of our sales observations. And so as a sensitivity, we use volume as one of the outcome or as the outcome. For another specification, we exclude March through August 2020 just to ensure that our results are robust to anything that might be happening around the start of the COVID pandemic. And then we also use a model or have a model using population weights rather than the stack difference in difference weights. And then for some identification and inference checks, there is one of our models where we were a little bit concerned about the pre-policy trends. And so we also use the synthetic difference in difference model as a robustness check. What this model does is it reweights the model such that the pre-policy trends between the treatment and control group better align and therefore is more robust to violations of the parallel trends assumption. And then one of the limitations of our data is that we have a small number of panels, and so therefore a small number of clusters. And when you have a small number of clusters, this can lead to standard errors that over-reject the null hypothesis. There's a number of ways that can be used to address this. We do two sensitivity checks, one using the wild cluster bootstrap p-values, and then another using doing a placebo test and plotting the coefficients of the placebo test and creating p-values based on that distribution. I don't have these results in my main presentation, but I do have it in the appendix if we wanted to look at that. And then, of course, it's also in the paper and will be on the presentation slides on the website too. Let's go ahead and pause here for any questions.
Thank you, Brad. Our discussant today is Dr. Madeline Dove, an Associate Adjunct Professor in the Public Health Sciences Department at UC Davis. Madeline, do you have any questions for Brad? Thank you.
Yes, thank you for this opportunity to discuss. This is a really interesting study, and you explain it very clearly. Like you mentioned, there has been, several studies in the U.S. looking at the impact of flavor restrictions on sales, tobacco sales and use. And this is, kind of one of the first in Canada. And Canada has a really interesting environment, where they've banned menthol cigarettes. And so the results, I think, can, provide something very new and interesting. Let's see. I was wondering if you could describe the tobacco purchasing patterns in California, in Canada. Where are most vapes sold? Is it convenience stores and gas stations? Are the patterns similar to the US?
So I can speak to the vaping market. About a third of sales happen at gas and convenience stores, and then the other 2/3 is from vape shops and online. So we only observe about 10% of the overall vaping product market sales. And then what was the first part of your question about cigarette sales?
Let's see. Well, I guess I was mainly interested in the vape sales because the data you have is just from gas and convenience stores. So, yeah, thank you for that explanation. Yeah. Is online sales are online vape and cigarette online sales legal in Canada?
Yes, they are. Yeah.
Okay.
But I mean, the flavor restriction some of them could apply to the vape shops and online sales as well. But vape shop and online sales are generally permitted for vaping products.
Okay. Okay, and it looks like you use separate data sources for the vape sales and cigarette sales. Why did you use separate data sources?
Really, it came down to availability. I mean, the cigarette sales are very high quality and contain the universe of legal sales. So that's obviously a very good data source to have. I believe our Nielsen IQ data did not contain cigarette sales, as far as I'm aware. I think Mike could verify that. And yeah. So that's the main reason for the differences in the data sources. And of course, a limitation of the Nielsen IQ is that it is restricted to gas and convenience stores. So we want to make sure that we're clear that is the sector that we're measuring effects for. And then also why we try to pull in that Google Trends data, which is not a substitute for sales data, but might give us some indication of consumer interest in those other categories.
Right. Yeah, it sounds like you have great data sources. Yeah, especially with the cigarette sales is very comprehensive, and then adding in the Google search data as well. Okay, I have one more question.
Okay.
I recently, I worked on a study and we used the stacked difference and difference approach, and I was just wondering if you had considered other approaches to kind of deal with the potential bias from staggered policy implementation.
We may have very early on. I can't remember the details exactly. I like the stacked because it creates a balanced panel for all the treated provinces, and so for that reason, I like it. That's something we could consider doing is showing results for some of the other models. I will say we do show results for all of our outcomes using synthetic difference in difference, which does not have that staggered adoption problem because it does the estimates one at a time for each treatment group. But we could consider incorporating maybe another model or two from the staggered adoption literature.
All right. Thank you. Excited to see the results.
Yeah, thanks.
Thank you. I think Abby Friedman added some comments. She says the Canadian government data is more comprehensive, but only include cigarettes. So that answers why you guys use the government data for measuring cigarette sales. So I see Mike is answering some of the questions, but there are some open ones. One is from Chris Science. Should we think of Google search interest as a measure of consumer demand? Google search interest tracks actual sales or consumption, or reflection of consumer preferences, or what consumers are thinking about in their purchasing decisions. He's wondering what the overlap of this outcome is with your other data outcomes and how it's different.
Mm-hmm.
Yeah.
That would be very interesting to see the overlap between the Google search data and actual sales data, and would maybe tell us a little bit more about what the Google search data could tell us. I want to be very cautious and make sure we don't overstate what the Google Trends data tells us, because I don't think it's not a proxy for sales. The main reason we're using it is because we want to make sure that we want to look for evidence of substitution to the vape shop or online market. And that's really one of the main reasons we're using it, because if there were increases in Google searches related to vape shops or online retailers, there might be evidence that consumers are substituting away from the gas and convenience sector to another retail sector. I'll go ahead and preview and just say that that's not what our results show. And so I think of it as currently I think of it as an indicator of consumer interest and maybe you could say preferences.
Yeah.
But I don't want to overstate it and say that it's a perfect proxy for sales, although like I said, that would be a very interesting study.
Yeah, Chris also mentioned that he think it would be useful to add a citation of the correlation between Google search for nicotine terms and the survey-based measures of use or sales.
Okay.
So I don't know if there is any study like this, but maybe someone has already done something looking into the correlations.
Yeah. No, that's a good thought.
Yeah. So I don't see any other open questions. Please go ahead and continue the presentation. Thank you.
All right, so I'll go ahead and getting into the results. We'll start with just looking at the descriptive evidence. So this is showing trends in the population-weighted unit sales in the treatment and control provinces. So we can see prior to adoption of any flavor restrictions, we see that sales were increasing quite rapidly in both treatment and control groups. But then once these flavor restrictions start going into place, we see sales in the treatment group begin to level out, whereas the sales in the control group continue growing, such that after all the flavor restrictions have been adopted, there's now a big gap between the treatment and control groups, where sales are roughly double that. The sales in the control group are roughly double that of the treatment provinces. Looking at the cigarette sales trends, we see that in the treatment group, sales were a little bit lower than in the control groups before the flavor restrictions went into effect. And then after the flavor restrictions go into effect, we see that cigarette sales are roughly on the same level, but actually a little bit higher than the control group. Right? Something else I think is important to point out is that cigarette sales are declining over time for both groups, which I think is going to help us at the end when it comes to interpretation of our results. All right, so looking at our formal modeling results, the results of our models, looking at the gas and convenience store total NVP sales, unit sales, we see a 29.5% decrease. Now, it's not statistically significant, but it is economically meaningful. It's a very, very large but imprecise reduction in sales. Now, breaking that up into specific flavor categories. So looking at the flavored nicotine vaping product sales, we estimate a 99.9% reduction in the flavored sales. Right, this is consistent with what we would expect to see. For the mint and menthol sales category, we also estimate a very large decline, about a 97%. So not as large as the flavored category, but that's what we would expect because there were some provinces that continue to allow the mint and menthol sales. And then looking at tobacco and unflavored sales. So we joined tobacco and unflavored into one category. We estimate very large increases in sales in this category, over 100% increase. So here we do find evidence of substitution from the categories that are prohibited to categories that are not prohibited. So here's our the results from the Google Trends analysis. So here we have searches related to vaping product shopping. We estimate about a 22% reduction in those Google searches. And then for vape shops, for our Google searches containing the phrase vape shop, similarly, we estimate about a 17% decrease, although only statistically significant at about the 11% level, so it's just beyond what would be considered statistically significant. But what these results tell us is that these results are not consistent with there being substitution to other retail sectors. And then looking at our cigarette sales data, we estimate about a 9.6% increase in cigarette sales. Now we were a little bit concerned when we first looked at this result, just because some of the pre-policy coefficients are statistically different than zero, and so that's why we pulled in the synthetic difference in difference model, which again reweights the model to better align the pre-policy trends and is therefore more robust to violations of the parallel trends assumption. And so here we do see better parallel trends in the pre-policy period, and then afterwards we also estimate a positive increase in cigarette sales, a little bit larger, or about a 21% increase. But nevertheless, this is still, this is directionally consistent with our early results and boost our confidence of that result. So as previously mentioned, we do a number of sensitivity checks. This is looking at the total NVP sales, starting with this is our baseline model. Standardized is using volume as the outcome rather than units. Then we drop March through August 2020, and then a population weighted model. All of these coefficients are very consistent and do not meaningfully change the conclusions of our analyses. Same thing with the cigarette sales. All of these coefficients are fairly consistent. Looking at these sensitivity checks within flavor-specific categories, again, all these results are showing very, very fairly consistent point estimates and do not change our conclusions. And then if we look over at this left-hand column here, these are different models that we use, our alternative models. So starting with the baseline model, it's the stacked difference in difference using a logged outcome. And then we show that a conventional two-way fixed effects model with a logged outcome, the synthetic DID with a logged outcome, and then stacked difference in difference using levels instead of logs. All of these results are across the different models are directionally consistent, and there is a little bit of variation in the precision of the estimates, but the conclusions are the same. So if we just look at this first column, looking at the unit sales per capita, all of these estimates are fairly similar in their magnitude, and actually in two of these four models, we actually get statistically significant estimates. Going to the far right column, looking at cigarette sticks per capita, 3 of these models estimate about a 10% increase in cigarette sales, and then one of them that the synthetic difference model is about a 20% increase. So results are very consistent across the modeling. Now I do want to mention a few limitations of our data or of the analyses here. One, we're using sales data, so and so we can't say anything, or we don't know very much about the margins across where these sales are changing, and so we can't say anything about use. So we can't distinguish between youth or adults. We can't say anything about initiation or cessation, and then participation versus the intensity of use. Another limitation of our data, again, our data for vaping product sales is restricted to the gas and convenience store sector, and so the results may not generalize to sales in other retail channels. So we tried to mitigate that a little bit with the Google Trends data, but still it's a limitation of the paper. And then also these flavor restrictions do vary a little bit across province in terms of the scope of where sales are permitted, and then what products are exempt. And so our estimate should be interpreted as the estimated effect of the average of these policies, and not any one specific flavor restriction. So in summary, we find that the nicotine vaping product flavor restrictions within Canada nearly eliminated sales within the flavored category, and then also eliminated sales within the mint and menthol category in those provinces that prohibited it. And then we also find evidence of substitution with large increases in the tobacco and unflavored vaping product category. And then we also see evidence of substitution to combustible cigarette sales. Now, if we remember looking back at the trends were declining in both groups. And so when we say we estimate that cigarette sales increased by 9.6%. That should be understood or interpreted as it slowed down the decrease of cigarette sales. Our findings in this study are consistent with what we see in the US. So this Friedman et al. Paper looking at sales within the US similarly finds that the vaping product flavor restrictions decreased vaping product sales and increased cigarette sales. And so because of the findings of our paper, it tells us that this pattern of substitution between vaping products and combustible cigarettes persists in Canada despite its stricter tobacco control environment. And therefore, this pattern of substitutability might extend to other countries as well of varying tobacco control environments. So for policy implications, right, we present evidence that these flavor restrictions can shift consumption towards combustible cigarettes, which are more harmful and could plausibly reduce welfare and harm public health. Now there's two sides. There's two sides to the public health equation. To understand the total impact or the net impact on welfare and public health, we would also need to know something about what is happening, what impacts they have on youth vaping behavior. Youth are less likely to internalize the full cost of tobacco consumption, and therefore have more internalities associated with them, and more potential for reductions in welfare. And so again, if the net impact on welfare and public health, it will depend on the impacts they have on youth vaping behavior, which we can't speak to in this study. Now there are some studies that are looking at or have looked at this. So this first paper here was recently recently published. It's a public health paper looking at Quebec's flavor restriction. They find that it was not associated with changes in youth vaping behavior. There's some mixed results within the U.S. So Kadi et al. Is a U.S.-based paper that finds that flavor restrictions reduce the vaping intensity of adolescents, but did not have impacts on overall vaping rates. And then Dr. Dove, our discussant, she also has some work in this category looking at flavored tobacco restrictions and its impact on adolescents with some mixed results there. She presented this paper a few years ago, and then also a couple of months ago presented a more recent paper. That the recording from that presentation is not up right now, but it should be up at some point in the fall. So if you're interested in that, be on the lookout for that. But in conclusion, given the evidence here that these policies can increase sales of combustible cigarettes, policymakers that are considering adopting these policies should bring that into the thought process and the calculation of the potential impacts of these policies. And that's all I have. Thank you, guys.
Thank you, Brad. Let's turn to our discussion today, Dr. Dove, to see whether she has any comments. Thank you.
Thank you. These are really interesting results, and thank you for including our work in your discussion. Let's see, I just have a few questions. Let's see, it does seem like the increase in the cigarette sales is a little bit smaller than the decrease in the flavored vape product sales. Is this something that should be emphasized or taken into account? And is this something that, the US studies have found as well?
So, I mean, one thing we do in our paper is we estimate whether the nicotine content from the change in vaping sales is equivalent to the nicotine content from cigarette sales. We estimate that it's roughly equivalent. Now, there's a lot of assumptions built in, and so it's hard to say for certain, but based on that, and that's in the paper, so you can read that if you're read about that if you're more interested in it. So I think it's roughly consistent now. As far as in the US, I'm not sure. I think so Dr. Friedman, who was one of the co-authors on that paper, she might be here. She might be able to comment on that. But I'm not certain offhand.
Okay, thank you. That the calculation that you did for the nicotine content, that sounds interesting. Let's see. And then I was just wondering, you mentioned that some of the provinces still allowed mint and menthol vapes. And I was wondering if there was a different result for the cigarette sales among those provinces that allowed mint or menthol vapes.
Yeah. So we do a one province at a time analysis, and we thought that we might see if they exempted the mint category, that we'd see less substitution to combustible cigarettes. It wasn't really clear to us that there was any pattern. Now across all provinces that adopted a flavor restriction, the coefficient was positive for cigarette sales. But again, the magnitudes did not really align with any one specific policy type.
Okay.
So I
Yes.
don't, yeah.
Okay. I think I saw, did Dr. Friedman, I think, did she respond?
Yes, she said it's to your prior question. This is hard to parse with sales data since we cannot distinguish intensive versus extensive margin changes. Yeah.
Okay. Um, okay. I just had one more question. So there's this, your results show that, there's you found an increase in cigarette sales. I was just wondering, can you recommend, like how would you modify the policy, or can you recommend a different policy to that might be more effective in reducing tobacco use or sales?
I don't know. That's a really challenging question. Just because, I think we also need evidence, more evidence on the impacts on youth and their vaping behavior. I mean, I think given the increases in combustible sales, I I would be more cautious about adopting a more comprehensive policy that bans it across locations. Like I would be more in favor of some exemptions for mint or menthol categories, and just maybe be a little bit more hesitant about more comprehensive policies. But again, I think we also need more evidence on the impacts on youth vaping behavior, to really be able to understand the net impacts of the policy.
Okay. Is there something in particular that you think would help for the evidence on youth vaping behavior?
Well, so I mean, there is some, right? We have done some studies in the US on this work. I think in particularly, there's not much within Canada, so I think that would be valuable. But also just to see, initiation into the vaping product market among youth. Right? If we see that these policies are really effective at reducing initiation into the vaping market, then then that might add to some of the public health and welfare benefits of the policy, and at that point, you're measuring the trade-off in the two policies. Um, so and I think something I recently thought of that you asked about maybe other changes to make, something specific to Canada, and I don't know how much this would make a difference, but Canada has fairly restrictive policies on nicotine pouches, right? And during the time of this study, nicotine pouches were not available at all, at least not to be sold legally within Canada, and they only recently became legal. In the presence of nicotine pouches, some consumers might substitute from vaping to pouches rather than to combustible cigarettes. So that's also a policy dimension as well. Now in the US, nicotine pouches are much more broadly available, and we see that substitution pattern as well. So yeah, so that's another policy dimension to consider.
Yeah,
And
that's really interesting.
yeah, and then again, it presents another trade-off, because nicotine pouches also create a new opportunity for more people to initiate into the nicotine and tobacco market. So
Mm, right, right. Yeah, thank you for that. And yeah, those are all of the questions I had. Great study.
Yep, thank you.
Thank you. So I see that there is some discussion in the Q&A, but I think Mike had most questions answered. Okay, so I see another question from Chris. Can we still make a statement though using Alcott's estimate of the relative harm of vaping versus smoking about the net public health impact of this policy, using net changes in cigarette versus vape sales that you estimate, or does this require too many assumptions?
I'm sorry, could you read that
I
question
think
again?
it's about the calculation of the net public health
Yeah.
using Hunt. I'm not probably pronouncing his name wrong. Alcott, Allcott. Do you remember the paper that
Yes.
doing the
Um,
relative harms of vaping versus smoking? Yeah.
yeah. Yeah, I mean, I do think, that there are some potential for public harm due to the increases in combustible cigarettes. Now, it also depends on where the reduction in vaping is taking place. So, as I've mentioned, um, if the reduction in vaping is taking place among adolescents, which could be some of it is, right, there could be some public health benefits from that as well. Right, doing this exact calculation is probably beyond the scope of the paper. But perhaps something to think about a little bit more.
Mm. Sure, and Doug Levy has shared a recent paper on the potential mortality impacts of vaping versus smoking initiated during adolescence. So that could also help understanding the findings in the context. So I think we are about time. So I'll let our MC Ping Chuan to take us up. Thank you, Brad, for the great presentation. Thanks.
Thank you, C and Brad. We are out of time, so if you still have burning questions or thoughts for Brad Davis, you can join us for Top of the Tops, an interactive group discussion. To join, please copy the Zoom meeting room URL posted in the chat and switch rooms with us once this event concludes. We'll leave the webinar room open for an extra minute after the end to give everyone a chance to copy the URL, which is bit.ly/chopsmeeting, all in lowercase. Thank you to our presenter, moderator, and discussant. And finally, thank you to the audience of 140 people for your participation. Have a top-notch weekend.